Better health begins at Tidelands Health, dedicated to keeping the communities we serve healthy and active. That's why we're proud to present our podcast series, Better Health Radio, brought to you by Tidelands Health. Here's Bill Klaproth.
Tidelands Health is launching an innovative prescription walking program to help get residents moving. Yes, you heard that right, a prescription for eligible patients to get more physical activity through a walk in the garden, a unique collaboration between Tidelands Health and Brook Green Gardens. How cool is that? So let's learn more with Dr. James Turek, a physician at Tidelands Health. Dr. Turek, this is really neat. How does this new program, A Walk in the Garden, work?
Well, Tidelands Health and Brook Green Gardens are partnering on a wellness initiative, and that's the Walk in the Garden. Patients who meet some of the following clinical criteria will be eligible to participate in that program. They have to be 40 or older, currently physically inactive or minimally active, and they must have one or more cardiovascular risk factors such as hypertension, diabetes, or high cholesterol.
Okay, so to be eligible, you have to be 40 or older, be minimally active, and have one or more cardiovascular risk factors. So then outside of that, are there other qualifications someone has to meet? And then how would someone go about getting this prescription?
This prescription is only available through Tidelands Health Primary Care. So at their next appointment with Tidelands Health Primary Care doctor, they will see if the people meet the criteria. At that time, the patient will receive a paper copy of the prescription. The prescription must be redeemed at Brook Green Gardens within 30 days of issuing, and there's no cost to the patient.
And that makes it even better. So this is very innovative. How did this idea come about?
As they talked to Brook Green, well, they decided that this would be a good way to get people walking in a beautiful setting, because Brook Green really is a gem of South Carolina here. And it's beautiful to go in. There are walking paths that are all marked out already. And ideally, if people can get walking, it can prevent diseases such as sudden death, cancer even. So it's really beneficial and can cause a little bit of weight loss too, which everybody could use.
Yeah, you are not kidding about that. What another added benefit to this great program. So how long is the prescription? Does the person get any other walking material? And what if someone falls in love with this and wants to keep going once the prescription is up?
The prescription is good for 30 days, and they'll get the pass to Brook Green Gardens, a welcome letter with some educational material, and they'll also get a map of some suggested walking routes. Now, if someone wants to continue walking after that day, I've been told that Brook Green will offer them a discounted yearly pass.
Got it. So if the patient really embraces the program and wants to continue walking, Brook Green Gardens will issue a discounted pass.
Correct.
So Dr. Turek, obviously there are other forms of exercise. Why walking? What are the health benefits of walking? It's
been shown to decrease people's risk of all-cause mortality. That's cancer, heart attack, fall risk. It actually walking can strengthen your bones and prevent osteoporosis. It also decreases cardiovascular risk for heart attacks and whatnot. So it really is the simplest thing you can do. Almost everybody can do it, and there's no real downside.
So what's been the initial reaction so far?
It's been very well received by patients. If they meet the criteria, they get the prescription, go to Brook Green Gardens and get the welcome packet and the walking routes, and they can get started and go as many times as they want in that month.
So for someone listening who's really interested in this, what should they do first?
First steps are to make an appointment with a Tidelands primary care provider just for a routine visit. The doctor or nurse practitioner or PA will let you know if you qualify for the program, Walk in the Garden. It's as easy as that.
This is so fun and beneficial, too. So after the 30 days, do people get a little diploma or a plaque after graduating, or do they just get the benefit of good health, which is in itself enough? They
get the benefit of good health. It'll be on the honor system, I think.
I love this. What a great idea this is, and I hope this catches on around more healthcare institutions around the country. Really innovative and a great way for people to get out and walk and enjoy the beauty of nature at the same time.
Exactly. There's no downside to it. If people think they qualify, come on and see us, and we're ready to pass these prescriptions out.
Well, I can imagine this is a prescription you really do enjoy writing. Dr. Turek, this has been great. Thanks so much for telling us about a Walk in the Garden program. Thanks so much for your time.
Oh, thanks for having me. Appreciate it.
And that's Dr. James Turek. For more information on a Walk in the Garden, just call 1-866-TIDELANDS. That's 1-866-TIDELANDS to schedule an appointment at a Tidelands Health Family Medicine practice near you. And if you found this podcast helpful, please share it on your social channels and check out our full podcast library for topics of interest to you. This is Better Health Radio. I'm Bill Klaproth. Thanks for listening.